In each part of this series, we have walked you all through data and findings from the new 2022 edition of CCC's Keeping Track of New York City's Children data book, highlighting challenges and opportunities for New York's families, as well as the impact of the COVID-19 pandemic on child and family well-being in New York City. In addition, we've highlighted key policy areas where we can mobilize around to ensure the needs of New York's children and families are met so our communities can recover and thrive from the pandemic. Today, we'll be discussing economic security and how improvements to childcare and increased access to income and housing supports can generate economic mobility. For our conversation today, we're going to hear from my colleague Bijan Kimiagar, Associate Executive Director of Research and Data at CCC. Bijan led the team that developed our 2022 Keeping Track data book, which you should be able to find in the chat. It is a beautiful and extensive data book, and we're so grateful for our data team for putting that together. Bijan is going to walk us through some of the data specific to economic security, childcare, and housing. Then we're going to move into a panelist discussion where we'll dive more specifically into each of these issue areas and some of our budget priorities around them. And if we have time at the end, we will answer some of your questions. But either way, we'll also be following up with the slides and recording of the webinar. With that, I'm going to hand it over to my wonderful colleague Bijan to discuss keeping track and highlight key considerations for economic security.
Thank you, Rebecca, and thank you to all of the panelists who are on here today. I'm really looking forward to this discussion and sharing with you all the data that are in the latest data book that my colleagues and I had the pleasure of putting together. I want to start the conversation today with some high-level information about New York City's children that we can keep in mind, and also some information about the data book itself. New York City is home to more than 1.7 million children, and this represents the largest child population in the nation, including more than 500,000 children under the age of 5. The city's child population is incredibly diverse. 1 in 12 children was born outside of the United States. More than half have at least one immigrant parent, and nearly half of all children live in a household headed by a single parent, or a grandparent, or a foster parent, or another relative. The racial, ethnic, and linguistic diversity of the city is also apparent in the child population. However, we know that segregation persists to a significant extent across neighborhoods, schools, and other settings in children's lives. And for this reason, we produce the Keeping Track of New York City's Children data book and have over the last 4 decades to present the facts, shed light on progress gaps and inequities stemming from structural discrimination, and demonstrate the importance of public policy and budget decisions on the lives and well-being of New York City's children and families. The data that we analyze in the book come from dozens of government sources, including the US Census Bureau, as well as New York State and New York City agencies, either through public data portals or through our team's requests to agencies for unpublished data. I'm going to give a little bit of a background on the structure of the book that you will find from the link that was shared earlier. This book offers the most comprehensive account of the lives of New York City's children and families prior to and during the COVID-19 pandemic. In each chapter, we spotlight data to understand both where we've come from and where we are in order to inform where we want to go on this roadmap to an equitable recovery. The book provides demographic information, like I shared just before, as well as facts about their economic security and housing security, which we will lead into today, as well as health and mental health, educational opportunities. We include data specific to youth and to the context of family and community. And importantly, a large part of the book, we include what we call geographic profiles. These are information specific about the 59 community districts, the 5 boroughs, and New York City as a whole. And I'll share more about that later today as well. What I'd like to do now is actually provide more information about the disruptions and stressors that families faced during the COVID-19 pandemic, but put into the context of what existed prior to the pandemic. It is through our analysis of data prior to the pandemic that we identify several areas of welcome progress in child and family well-being for the city overall, such as lower poverty rates in recent years prior to the pandemic, greater access to early education, fewer children in foster care as another example. But for the sake of time, I'm going to narrow in on a few examples specific to the topic today about economic security and housing security, as well as food security. So from 2010 to 2019, our city recovered from the Great Recession and saw consistent growth in median income for families with children. Yet we also know that extreme income inequality continued over this period, reproducing high poverty rates, particularly for children of color in households headed by a single mother. When we think about these data from just prior to the pandemic in the context of the unprecedented spike in unemployment and income loss, we are very concerned about further threats to racial and gender-based workforce equity, especially when we know women and children report higher rates of being out of work and are more likely to cite lack of childcare as a primary barrier to employment. And here are these data specifically. We know that while the share of out-of-work adults aged 25 to 54 living with children was similar at the start of the pandemic in 2020, over the course of the pandemic, more men in this demographic have returned to work, but more than 40% of female householders with children reported not working, which is much higher than the 24% of male householders with children reporting the same. Female householders were more than twice as likely, which is looking at this area, more than twice as likely than men to cite childcare as the primary barrier for their unemployment. As we know, at the start of the pandemic, the COVID-19 pandemic, the economy in New York City was upended after a period of growth. Millions were out of work and left the labor workforce. And while this has improved, we see that the city continues to lag behind the recovery at a national level. The pandemic also posed immense challenges for the safety and sustainability of the city's working conditions across industries. And it's through this experience that we use now the term essential workers. This idea that many people are critical to the daily functioning of life in the city. And we also have now this term working from home being commonplace. We know that 1 in 4 city residents worked in frontline industries such as healthcare, public transit, delivery and cleaning services, food and drug retail, and social services. And in comparison, 1 in 5 reported working from home. The duty of the essential work in the frontline industries is disproportionately on the responsibilities of residents in neighborhoods where median incomes are lower, while the ability to work from home is more accessible to those in higher income neighborhoods, posing part of the issue of equity that we're trying to address in today's session and in our policy and advocacy work broadly. The increase in economic insecurity influences many aspects of children's lives, not least of which are their housing and food security. We know from data from the Household Pulse Survey that 1 in 2 households with children reported difficulty meeting their weekly expenses. 1 in 3 renter households with children reported being behind on rental payments. 1 in 7 households with children reported sometimes or often not having enough to eat. And these conditions affect young people's opportunities and challenges in profound ways. From these data, we know that 1 in 10 households with children reported 0 days of live contact with teachers over an average week, and 1 in 2 youth ages 18 to 24 reported symptoms of anxiety and/or depression. Importantly, these heightened insecurities that the pandemic has elevated are reinforcing racial, ethnic, and socioeconomic inequalities that we've seen prior to and during the pandemic. Families of color, which is represented by these data here, as well as families earning less than 50%, which these data is represented here, report higher rates of what's called material hardship, or food insufficiency during 2020 and 2021. We'll talk about this more in a moment. We also know that the share of households with children reporting food insufficiency is higher than households without children. In fact, it's actually double the rate in the most recent reports that we looked at prior to including these data in the data book. About 15% of households with children reporting sometimes or often not having enough to eat, while those without children, 7% reported the same. In addition to the increases in utilization of public nutrition programs, which is called SNAP, the Supplemental Nutrition Assistance Program, millions of New Yorkers turned to community-based supports such as food pantries and soup kitchens in 2020. And this is what's showing on this graph, the kind of uptick from 2019 to 2020. And importantly, among households with children, reports of receiving free meals and groceries, nearly half of those were from schools or from children's programs that families were receiving supports. So showing the importance of community assets in supporting the emergency situations and an ongoing recovery. In another example of a disruption, we know that prior to the pandemic, there was historic growth in early education programs and in after-school and summer programs. And our task now is to ensure that the decreases in enrollment are rectified, but also that we increase enrollments and access to these programs broadly, because they are critical to children's well-being and to families' economic security, because they support working families. Looking at housing conditions and data for a moment, New York City's housing market continues to be a place where there are inequities. Black and Latino residents, which is looking at the data here on this chart, receive far lower shares of this area receive far lower shares of home purchase loans from regulated banks. And then if we look to the right side of the screen in terms of housing discrimination inquiries, we see that hundreds of reports of discrimination are filed annually on behalf of residents about whether because they're using a housing voucher or because of their race or gender or disability status. Looking more specifically at the situation of families in shelter, we saw that prior to the pandemic, there was a decline in the number of families in shelter, which was welcome progress. And during the pandemic, we saw an even steeper decline. However, we know that finding permanent housing for those who've remained in shelter has been even more challenging during the pandemic. And thus the average length of stay for children, for families with children in shelter jumped to 520 days in the most recent fiscal year data. It is also important, as we were talking about earlier, this issue of housing insecurity is an issue of racial and gender justice, because we know that 94% of heads of households of families with children in shelter are either Black or Hispanic, and the vast majority are women with young children. What I'd like to do now is take a moment to share some examples that are really part of this roadmap to an equitable recovery, and using this idea of resiliency. The idea of resiliency acknowledges the scars that we've been through for the pandemic, and they are reminders that we are a new version of ourselves, that the city we are and the city that we are becoming is taking into account what's happened during the pandemic, and what the vision that we see for an equitable recovery that CCC sees is that one that invests in children and families as a key strategy for developing a more equitable city. And we see that when federal, state, and local governments invest in families, these investments make a huge difference for families and for society as a whole. And I'll give a couple of examples. In late 2021, there was the temporary expansion of the federal child tax credit, which provided critical relief to millions of families across the country. And in New York State, more than 3 million children benefited from this policy. And we know, looking at the data on the right side, that economic security improved. Food insufficiency decreased, reports of eviction being likely decreased. But without continued support of this program and making this expansion permanent, we should not expect to see this increased economic security without ongoing or new economic programs and initiatives. In another example, we know that the eviction moratorium, data on the left side of the screen, show that there was a prevention of many private eviction filings during the pandemic. The moratorium has since been lifted. Now there are concerns about what risks this posed to housing security of many families throughout the city. And looking more narrowly at the universe of city shelters, we know that the rate of families with children re-entering shelter within 12 months of exiting has dropped to 4% based on the last fiscal year data. And that rental subsidies to families to find permanent housing were a key reason. And we see that the rate of reentry of families exiting shelter within, or of the reentry of families with reentering shelter within 12 months is only 1% when they receive a subsidized exit, in comparison to 16% when their exit is unsubsidized. So again, this is an example of how when we invest in families, we're actually investing in society as a whole. I want to draw attention to one component of the data book before we move to a panel discussion, because it's one aspect about the book that we really tried to elevate in this edition, which is the community resources that exist. On this map, we have the presence or absence of banks that are part of community districts. And on the left side, we see the different community resources that we report on in our online database. We take some of these and actually include an asset map, which is new to the geographic profile section, so that we don't just look at the data that looks at poverty or other challenges, but also looks at the presence or absence of community assets that exist. Things like banks, like I mentioned, but also the availability of large food retail, hospitals, public libraries, and open space such as playgrounds and parks. It's with this that I'm going to transition back to you, Rebecca, to lead us into the discussion. I really appreciate the opportunity to share this information with you and hope that it addresses some of the issues that we'll be discussing next.
Thank you, Bijan, not only for conveying the data so eloquently, but also conveying the implications of our data. I'm excited now to move into our panelist discussion. I'll be moderating this discussion, and I'm joined by three champions for social change for New York's children and families. Our panelists are Debbie Priya Chatterjee, Senior Economist with the Community Service Society, Khadijah Davis, a Fellow with the Family Homelessness Coalition, and Gregory Brender, Director of Public Policy with the Daycare Council of New York. Point within the presentation that most spoke to you, and can you reflect on why that most spoke to you?
I think for me, one of the things that was really powerful was looking at some of the areas where there have been improvements, but seeing that those improvements have not been shared equally. I think Bijan really laid out really well some of the areas where inequality is actually growing. And one of the ones that stuck out for me was around how families in more high-income neighborhoods are also the folks who have greater access to the ability to work remotely. And that, I think, is something where, you're seeing something that I think will be an improvement in the life of a lot of white-collar workers, but is going to continue to be something that doesn't change for a lot of people who are doing the frontline work. Working in early childhood will continue to be an in-person work for all of the folks providing early childhood education, but also, the families we serve are very often those who not only don't have the option for in-person work now, but were most often the essential workers who had to be doing in-person work during the height of the pandemic.
Yes, thank you, Gregory. And also just how mothers are leaving the workforce altogether because they simply can't find childcare. So thank you for that. Khadijah, I'll hand it to you next.
I was also seconding that because my mic is all on. Um, it's very interesting, the whole dynamic of it all, but I think the root of it is like the people who are essential working out there on the front lines, like for example, at a Target or a Walmart, they are working hard, helping us, making sure we get essential things, that we do need food, we do need baby formula, we do need clothes to survive. And they were also getting paid the least amount, but they wasn't appreciated by, people appreciate them, but the money coming towards them wasn't what they needed fully, like enough to able to get their family to be supported properly in this pandemic. And that's kind of sad that they're doing so much, putting their life out on the line every single day, but yet they can't even help properly to keep their families food on the table because of the money they actually have coming in. So that's very interesting to me.
Yeah, and you saying that reminds me of one of our policy priorities for this budget season, which is making sure that the human services workforce is paid, because they're really the backbone of our economy, and they are, they're our frontline workers, and they've really been carrying us through recovery, and they're the people who need to be paid and are not receiving the resources they need to keep working. So Debbie Prey, I'll hand it to you.
Thanks, Rebecca. And thanks to Bijan for a really eloquent and a very good presentation. Like, I work with data all the time, and you really made the story stand out with your from the facts. One of the things that stood out to me, I wouldn't say stood out, but that I would like to underscore is the food insecurity issues that were highlighted. We know that the child tax credit, when the expanded child tax credit for a year, when we had it, it made a quantitative difference in folks' lives. It halved poverty, but we have let it expire, right? We don't have it anymore. And we saw similar rates of food insecurity using our Unheard Third survey, which is our annual survey of low-income New Yorkers. It's biased towards low-income New Yorkers. We saw 25% of all low-income families say that they went hungry. 36% said they seek out food from soup kitchens or other families and relatives. And 20% of these families had children. So 1 in 5 kid in the richest city, in the richest country of the world, goes to bed hungry. And there is a library of research underscoring the long-term deleterious consequences of lack of adequate nutrition. And it is just something that is very hard to actually digest. Just wanted to say that.
Thank you so much. And yeah, we are going to get a little more into our discussion about the effects of direct cash relief and how that can help families so much and alleviate poverty. My next question is for any of you who want to answer, where, if at all, is the intersection of housing access, childcare, income supports, and economic mobility? How do these issues overlap?
I think money is honestly the key focus in a lot of things. The reason why I say this is because I used to be on welfare, and to get on welfare, you have to be under a certain threshold. Mind you, the poverty limit for this threshold has not been, changed for a while. They tell you that they want to make sure you get a job, get this and that, but when you get a job, they say you make too much, but you're honestly not making enough to really survive, just making enough to make sure you have clothes in your back and food in your stomach and, a house over your head for your kids. So sometimes you have to end up leaving a job or try to get something lower just to be able to, example, welfare pays for childcare, they pay for food, they help you pay for rent, which is not that much money, but they give you, if it's 2 people, $283 a month, right? Because I have me and my daughter. And it's like, do I work a little bit paying job what pays me like $16 an hour? Or do I take welfare what's gonna pay daycare and give me food stamps? Like, you have to kind of decide or try to find another job what's paying $20 or $30 an hour. And even though I have a degree and I'm still paying off loans to the government, I can't even find a proper job to help me support my family. So I think it comes down to money. It comes down to opportunities out there for a lot of people. And without money, you can't really survive. Like, you need food, you need all these necessities just to survive and be a person who's productive in society. Without a proper job, you can't do that. So I think it comes down to money, and it's kind of intersection with everything together. So I think money does play a big part. And even when you have HRA and stuff like that, with when you get like vouchers and things like that, that also affected, because if you make even a penny more, city theft is out the window. So you have to always think about, can I afford to live off without the government, or how can that work? And also then childcare comes into play. Who's gonna watch my kid if I do too many hours at work? It's a big machine, and it's kind of breaking down. And we just need to come as a community to work it together and help everybody be successful in life, because everybody deserves to have a happy and healthy life, to be honest.
Rebecca, if I can just add quickly to what Khadija said, I feel like all of these issues are intersectional because of the system in which we find ourselves. You know, you look at benefit cliff that that Khadija is referring to. Like when your income goes up, your income doesn't go up enough, but your assistance drops significantly, right? So all of these systems are a legacy of the history that we have had, the political history, racism, structural racism, and so on. So it is, of course, all of these are intersectional. For example, housing access, housing stability, we know they're important for child's development, but even thinking beyond the immediate material relief, you know, it is like, if you take off the anxiety of trying to make ends meet at every time, it makes such a qualitative difference in the kids' interactions with you. Like, you know, you're focused, you're not stretched on bandwidth, and your interactions improve. They go on to be better, longer. They go on to be adults who then earn more, right? So that's about economic mobility, like you asked. Like, how does economic mobility feature into this? And that's my understanding, that, you know, these are investments that will show up as mobility, but we are not being able to do those investments because of the structure in which we find ourselves.
Thank you both so much. That was you really framed that in a way that I think makes sense. And if you know, economic mobility,
You're back cutting out for me. Is that for everyone?
Yes, it's for everybody.
Oh, I'm so sorry.
You're back now, though.
Yes,
back?
you're good now.
Yes.
Okay. I'm ready to join on my phone if I need to, but thank you, Gregory. Let me know if that happens again. But yeah, I was just saying that these, you know, these issues all intersect, and like Khadija said, money is the root of all of these issues. And, you know, it's so interesting how we have these income thresholds you need to meet to receive these welfare programs. But then if you're not in those income thresholds, you're expected to be able to pay for childcare and housing and all these other things when you're just above the threshold to receive welfare. And like Debbie Priya said, if you move up, you receive less welfare, but it's significantly less than the income increase that you receive. So I really appreciate you both chiming in there and explaining that both so eloquently. Debbie, I'm going to come back to you, and you've kind of touched on this, but what are some of the biggest barriers facing New York City families living in poverty?
So I'll base this answer off of a couple of sources of data that I encounter. I would say housing instability, housing unaffordability, and food insecurity that families facing in families experience, those who are in poverty. So these are their core challenges. And to get out of this situation, the biggest barriers they face are low and stagnant wages. It's low and stagnant wages, partly a result of the kind of industries and occupations they are, like that we have crammed folks into. Inadequate workplace protections, the rise of the gig economy, like, you know, so the fissioning, that what we call the fissioning of the workforce, is now sounds fancy, but what it just says that I'm outsourcing every single part of my work as an employer into very different entities, so that none of them, I'm not responsible for well-being of my workers in any ways, right? So the rise of the gig economy, the low and stagnant wages, lack of workplace protections, high housing costs in the city, and gaping holes in the safety net. We were just talking about this with Khadija, and some of the gaping holes are by design, right? By intent, and then finally, and some are just the artifact of how they are designed, and finally you have the lack of access to skills that would lead, be a trajectory for you to end up in a quote unquote good jobs with benefits. So we are doing a poor job matching employees to work opportunities. We're doing a poor job matching them to the training, the need of the hour. You would read accounts all the time that firms are not being able to fill positions. But that doesn't percolate down to the training that we are providing to the workers. So these are some of the key top line reasons, I would say, about the barriers people face in poverty.
Thank you so much for sharing your expertise on that. And I know one of the major barriers right now in New York City and across the country is childcare. And Gregory, I would love if you could discuss the connection between poverty and childcare access in New York City.
Absolutely. And thanks for giving me this opportunity. I guess I'd start with talking about childcare as being a key work support for families. And as Khadija mentioned, a lot of families who are on public assistance are often concerned if you get off public assistance, if you get a job but it just doesn't pay enough to cover the continually rising costs of childcare, that they won't be able to afford it. And lack of childcare becomes an economic development issue at all levels. We see it at middle-income families just really struggling, but we also see a lot of low-income families where the costs of childcare are what it would take to push them over the edge. So for families, it's really a crucial economic support. And one of the things we've really seen when there's a lack of childcare is it particularly affects women. As you see women taking on more and more of the burden of childcare, it ends up affecting their earnings, their careers, their professional development. But also we want to think about childcare and the connection to poverty as childcare is a part of educational equity. Families that can afford it almost always do get childcare, and they get high quality programs that are the kind of programs everyone wants to send their kids to, where they're wonderful, nurturing environments, where they let them express their creativity. So ensuring that all families have access to high quality early childhood education and high quality early childhood education that actually meets their needs is incredibly important, because that's how every child can really start and go into kindergarten believing that what they can do, because they've been doing great things in preschool and doing great things in infant toddler programs. Finally, we also have to see childcare and the connection to poverty, unfortunately, in the poverty that a lot of our own staff experience in childcare programs. Many childcare workers in childcare centers are working at near poverty wages. We're actually hearing cases of people who are professionals, sometimes folks who have CDAs or others, leaving to take jobs in retail or fast food because needing either the better hours or in some cases better pay. But we also see people struggling at other levels in their career. We see a lot of directors of childcare centers leaving to become teachers because they don't get the longevity increases that they would if they were in the public schools. So we, Daycare Council, our Citizens Committee for Children, of course, all our colleagues in Campaign for Children are really fighting for salary parity for the early childhood workforce, because early childhood providers and staff throughout the human services, we really do need to bring our own staff, the people who are making these programs possible, out of poverty and pay them the fair wage that they deserve.
But also how
You're
this
breaking
is
up.
how
You're
this
good
is
now.
affecting women. I am just gonna join on the side, and if it happens again, I will be able to just talk into my phone. But one second.
Recording in progress.
Are y'all able to hear me?
Yeah, but you have an echo.
It's because I wasn't muted. There we go. How about now?
That's excellent.
Okay, sorry.
No
I have this
problem.
problem all the time. But Gregory, I appreciate you bringing in the fact that this is affecting women more so than men, and that childcare access is really a feminist issue. And I really appreciate you bringing attention to that, as well as our priorities in the Campaign for Children's priorities. The Campaign for Children is a decade-old coalition that's focused on childcare expansion and increasing access in New York City. And one of our huge priorities this budget season is to ensure pay parity for these community-based childcare providers who are not being paid well and are leaving for the DOE because they deserve pay that can stable incomes that can keep them in the workforce. So I really appreciate that. And then Khadijah, I'm going to turn it to you. In your opinion, what is one of the biggest barriers facing families who are at risk of losing their housing or who are living in shelter?
I think the biggest problem is that when you have a voucher, which is like city FEPs and things like that, they say after a certain amount of days you get it. You qualify for it when they give you all these criteria, which honestly, for myself, they told me when I get in the shelter, I'll get it. And I never did. I never qualified for it because I had too much boxes I had to check off. So to even get it is like pulling teeth. And then when you finally get it, it stays in your hand for a long while till it expires, because so many landlords don't even take it. So you're in there stressing out, and you're stressing like, I want to get out of here. What can I do? I'm doing the legwork. But even though they gave me this voucher, they said some amount of money, and the money has gone up. Because before it was like it's under a certain amount. So now they raised it up. But even when the money is put up, landlords still don't trust it because of the whole system. If you don't know, if city FEPs takes a long time to even get it gets approved. We have to go through HRA, things like that. They have to go inspect the apartments to make sure these things are good. Honestly, my solution to that is just to do everything on Zoom and make sure the landlord looks like come out from the apartment outside so you can know, like, make sure there's the right apartment and kind of inspect the apartment that way. Things will go so much faster, especially with how we are doing things now anyway. And honestly, if you think about it, it's more safer. But I digress. I'm not in charge of that. But whoever's hearing, hopefully you can put that out there in the world. But I think that's the biggest problem. Giving people kind of hope that you'll get out of here. And then when they get the paper, their hope is lost when they keep on going to everybody to say, I don't take vouchers, which is technically discrimination and wrong, but it's being done. And as people are not really, I guess, investigating enough to get people in trouble for it. This is why it's keep on happening over and over. So I think that's one of the biggest problems people in shelter have. And also another problem that they have is when you're not even working money. Example, at one point in the shelter, I wasn't working. And the shelter people told me, I need a tissue, toilet paper. And they told me, you can't get that. We don't provide that for you. So I have to go to somewhere like a McDonald's to get some like napkins to just use in my little room that they gave me. So I feel like certain basic things that you might need in a shelter, I think you should be able to get that. And I think also every shelter should get a laundry room, because not every shelter has it. Because to do laundry is very expensive, and it should be free for people who live there at the time. But think about all the other things, feeding your kids. At this point, people who have babies just looking for formula, because formula isn't a shortage, as you might know. So I think those are kind of the limitations that a lot of people have in shelters. Like, you have so much things to think about. People go in depression. People come there just fine, and when they leave with 2 or 3 different problems because they can't eat right. They're stressing all the time. They get anxiety. People are fighting. People are dying next to them. And you might think no, that's not true. No, it's true, because the shelter I lived in Queens had metal detectors with so much violence there. And police were always there all the time. Ambulances were always there all the time. It was always something. You cannot imagine you're living in a small war zone in New York, in Queens. And you're like, when I'm going to get out of here, they say, it's just a lot of different things. So I think those are some of the problems that people in shelter do have. And I'm not saying it because I read it somewhere. No, I experienced these things. These are not things I have to hear a story about. I do hear people's stories all the time because I do this all the time. But this is the life I lived at one point. And I'm not ashamed of, saying it. At one point I was like, oh my gosh, people are going to hear this. But it doesn't matter. What I say can help somebody. And if I can help somebody make a difference in their life, I'm okay with doing that. So those are some of the problems that people in the shelter do have.
Wow, Khadijah, this is why I love having you speak and join us for our events, because you are just you're so brave to be able to share these stories and to be willing to share these experiences. And they also help so many people understand what's actually happening in these shelters. And I know you're a fellow with the Family Homelessness Coalition, and you mentioned shelter conditions and what you're not getting access to and what's lacking in shelters. And that's one of, as you know, the big, one of our big priorities in the Family Homelessness Coalition is to focus on improving shelter conditions, but also improving prevention programs. And like you said, City FEPS it takes a really long time to get approved. It takes a really long time. And you have to check off all these boxes, and you have to have a certain amount of days in shelter or a history of shelter. And it's not really a prevention tool, right? It's a crisis intervention tool. And we need it to be a prevention tool to actually prevent people from going into shelter and experiencing homelessness. But City FEPS comes in when it's far too late. So I really appreciate you sharing all that. And yes, thank you so much. I'm going to turn it back to Gregory. The budget process.
You're breaking up.
How about now?
Now's good.
Much
Now you're
better.
good.
Okay. 1 second. I turned my Wi-Fi off my phone. What in the proposed city budget, Gregory, brings you hope in regards to early childhood education, and what do you wish for in the final budget to improve upon?
We're excited. I think that there's a lot of attention to early childhood in the city council and from the administration. We've seen, I think it was 18 city council members come to a press conference just last week, organized by Councilmember Menon around early childhood proposals. And we're actually very excited about a proposal called Care for All, which is a campaign to bring $10 million to support childcare for undocumented children. The state did not move to provide childcare for undocumented children. They would still be excluded under the state funding, but it looks like there's a strong possibility and there's a lot of momentum. More than half the city council has signed a letter calling for this funding to be included in the budget. So there's a lot of momentum for the city to do the right thing, and we're really excited about that. I would say one of the big kind of themes, though, that we need to talk about more is, even as there is a lot of increased recognition of the importance of early childhood, the early childhood sector is still facing a lot of instability. Childcare programs are facing a staffing shortage because of the low salaries that we've talked about. The lack of salary parity is seeing qualified educators, qualified support staff, qualified directors, all leaving their roles and taking with them that earned experience and the continuity of care that longstanding employees can bring. We also are just facing instability because there's instability in the actual payment of contracts. Right now, enrollment is fluctuating because of COVID, as it has been throughout the COVID crisis, and contracts are structured in such a way that providers actually receive reduced funding if their enrollment fluctuates. And that's a huge problem because the fixed costs really don't change that much. If you have a staff, if you have rent to pay, those costs aren't changing. And so you're seeing a lot of childcare providers really struggle to stay open. And if we want to, as we do as a city, want to really fully reopen and fill all of the skyscrapers with people working in them, they're going to need childcare. They're going to need their childcare centers to be open, strong, stable, and the kind of nurturing places with experienced staff that anyone would want to bring their children to. So we really do want to see the city take action. And a few of the ways that they can do it is, one is suspending the pay for enrollment practice, moving towards line item budget, as the city has done actually in the past when there were previous attempts to move to a pay for enrollment system. Funding for increased extended hours and infant toddler programs. There's been a lot of expansion of programs that run for the school day, 6 hours and 20 minutes, but there are more and more families who need the extended day, who need something that's based on the work day and not the school day, and which also covers summer. So moving more programs from being standalone, from being school day, school year to extended day, extended year, and even to cover more non-traditional hours as you have more and more families who are working in non-traditional hours. And finally, to extend to the amount of infant toddler programs. Young children, the youngest children do need childcare. A lot of parents are going back to work very soon after having children and really do need both the childcare for their needs and then the socialization that comes from being in a group setting. So we do want to see increased infant toddler program, perhaps moving some of the unutilized 3K and pre-K slots towards extended day infant toddler programs. And yeah, we are excited. Everything we're hearing is there's a budget soon. So we hope to see the administration and the city council taking action on these important items.
Thank you, Gregory. I think something you said that's really important is that there's a big push for employees to get back to work, but we have a dearth of childcare, and infants and toddlers also need childcare. You know, those families need people to take care of their babies just as much as a 3 and 4 year old need childcare. So thank you so much. Khadija, I'm going to move to Debbie. How will an EITC enhancement make a difference for low income families? Sorry, EITC is the Earned Income Tax Credit. I should have led with that. Debbie, how will an enhancement or deepening make a difference for low income families? And what are other steps the city can take to increase economic mobility?
Thanks, Rebecca, for that question. The context, I'll just say for those who might not be aware, very recently the state approved measures to expand local EITC as well as increase the state EITC for a year. And we were looking into it as a measure to enhance economic mobility, and published a report on this. And I'll draw on the report in my answer. So earned income tax credit is a refundable tax credit that is something that you get, that money you get back from when you file tax returns if you are eligible for it. It as the name suggests, it's an earned income tax credit. So it's the more you earn, in the initial phase, the credit increases, and then it reaches a plateau, and then it tapers off as your income continues to increase. EITC has been proven to be a major anti-poverty tool, pulling out an estimated 5.8 million or so folks out of poverty. It is something that one of the rare things that enjoys bipartisan support still at different levels of the government, both city, state, and federal. And so it seems like an easy lever to be pulled to enhance economic mobility. What we can do is increase the amount. The local EITC is 5% of the federal EITC. The state is 30%. Current for the 1 year expansion is 37.5%. But anyway, how it will work is it will stimulate the local and regional economic output by increasing spending and creating new jobs and improving wages. So it has been shown that money that folks get from child tax credit or earned income tax credit, they typically spend on very local kind of purchases like school supplies, rent, food, things like that. So basically you're taking these dollars and re-injecting them back into the economy to have a longer lasting stimulating effect. So the win-win for both sides. It would also address the declines in income suffered by workers in low-wage industries that were hit hardest during the pandemic. As we know, the effect of the pandemic was very uneven. White-collar workers hardly ever even felt much of a dent, and folks in essential services and frontline workers or leisure and hospitality, they were kind of decimated. So EITC can help in ameliorating that. It would improve after-tax incomes for workers naturally, and prevent a lot of them from slipping them into poverty. There's a simple direct cash effect of it. And it would address racial, ethnic, and gender inequities that have worsened because of the pandemic and the recession. EITC programs serve a larger portion of workers of color, and thus an increase in the credit amount. So if you do something that is working more for folks of color, and you increase the amount, then the impact would be bigger in people of color and alleviating their poverty. other than that, to Rebecca's second part of the question, what can be some of the other measures, local measures that city can take? We would say, like, investing in children, like, Gregory said, whether through a child tax credit or by setting up a universal child care allowance, or increasing the EITC for ITIN filers. So the ITIN filers are a special category of filers who file without a social security number. So these are often immigrant folks who do not have a social security number for a variety of bureaucratic labyrinth of reasons, but they are putting money into the tax system. They are filing tax returns. We just deny them EITC for no reason at all. The city can do that by expanding it to ITIN filers, by expanding the amount for childless working adults. And all of this will help in fast track economic mobility and economic recovery in the city.
Thank you, Debbie. Yeah, you touched on some of CCC's priorities with expanding the EITC, the Earned Income Tax Credit. And like you mentioned, it won't only help families directly, but it'll also be helping the economy and help us work toward a recovery. And CCC also has priorities around expanding child tax credits, both at the federal, all three levels, federal, state, and city, and also looking at other ways to get cash into families' hands and pockets through tax credits or direct income supports. So thank you so much, Debbie. And then Khadija, I'm going to turn to you for our last question. What is one issue pertaining to housing insecure families that you would like to see the city address this year?
I feel like putting back the credits that was given last year. For every month, people got those little checks. It might not have been much, but for a person who needs just a couple of dollars to help with their rent or help with food, I think that program should be on for a couple of years. But still, the numbers are going back up. Like, it's like an on and off thing. We've been in here for a while now. We thought by now it would be ending. It obviously is not. I think that program would be great to have. I think probably as they start with the kindergartners, like a slow $100 in their account. I think that probably should be all for all age kids because everybody needs the money, honestly, at this point. I think that would be a good kind of way to help out people right now, and probably drop the cap amount for people they get food stamps. If you don't want to give people cash, people need to eat. So if they can make higher, if a person make like say 46,000 a year, 50,000, I'm just throwing out numbers here. I don't have the exact things written down, but make them be eligible food stamps. I think that would be helpful. If you don't want to give out the money every month, the cash like you was doing before, give people who qualify with kids, and even people without kids, the single people still are, even though they have a job, it's hard for them to make rent. A lot of people are in roommate situations because they have no choice. They can't help it. Sometimes it's not even a good roommate situation. So helping them with food will definitely be a way to help a lot of New Yorkers and people honestly in America, because people need the help. They're screaming for it. They have campaigns about it. They need help. So I think that would be some ways that they can help people.
Thank you, Khadija, so much. And thank you to Gregory and Debbie as well. You guys were awesome, and I'm so happy you all three of you joined us and offered your expertise. And that's going to conclude our panelist discussion. It's clear that change must happen in New York City, and it must happen now to ensure that children and families are not left out of New York's economic recovery. So thank you, all three of you, so much. I'm very grateful, and this was a really great discussion. I'm just going to move quickly into our priorities as we only have about 4 more minutes left, but as we heard through our panelist conversation, CCC has lots of priorities that work to ensure housing stability, access to childcare, economic mobility, as well as others. As previously mentioned, the budget is soon to be finalized, but we want to conclude today's webinar by leaving you with the top priorities we are pushing in the final days of negotiations. So the first one is that more than a quarter of New York City families report being behind on their rent. And since the beginning of 2020, over 115,000 eviction filings have been submitted across the city. As Bijan discussed in his presentation, currently programs like City FEPS, as Khadija mentioned, are acting as crisis intervention tools rather than serving their purpose as prevention programs. Furthermore, the program City FEPS lacks funding. This year, we are asking for the city to increase budget funding for City FEPS by at least $35 million to fully fund the cost of the program, and increase upstream access to city PEPs by eliminating program requirements that necessitate an eviction filing, shelter history, or income to qualify. As Khadijah so well laid out, these programs are very hard to access because there are so many boxes that need to be checked. Second, as Bijan mentioned, the average length of stay for a family in shelter has skyrocketed to 520 days. When we don't prioritize permanent and affordable housing solutions for families, the likelihood of shelter reentry increases. Part of the reason for prolonged shelter stays is due to understaffing at city agencies that help move families out of shelter. This is why we need to oppose the budget cuts that reduce staffing within HRA, DHS, and HPD, and the city must increase access to affordable housing for families in shelters and families of domestic violence. Moving into childcare, Gregory touched a lot on the issues that parents are facing to secure care and the issues that providers are having to remain open and support their workforce. It's crucial that we expand our childcare system to provide more options for families. That means extended day and year-round care must be accessible, as well as comprehensive care for infants and toddlers. We must also invest money in this year's budget to reach pay parity between community-based childcare providers and their DOE counterparts. We must also support the Just Pay campaign to address and combat inequitable pay among human services workers, as Khadijah touched on, as well as Debbie, by establishing a cost of living adjustment, setting a living wage floor, and creating a comprehensive wage and benefit schedule for government contracted human services workers. And lastly, we want to find ways to increase incomes for the hardworking families of New York City. As Debbie touched on, direct cash relief helps to lift incomes and alleviate poverty. And that's why we're calling on the city to enact Mayor Adams' proposal to invest $250 million to deepen the EITC for the lowest earners. These priorities, as well as our full list of budget asks for this fiscal year, can be found in the chat. I want to thank all of you for joining us today. Thank you, Bijan, for the data presentation, and Debbie, Priya, Khadijah, and Gregory for sharing with us your expertise. And we'll be following up with everyone with the slides and a recording of today's conversation. And if you are able, we welcome you to join us for our budget rally tomorrow morning at 11 a.m. It's on Zoom as we work to influence the budget in its final days. We'll be sharing a link for that event in our chat. Again, thank you all for joining us and for the work you do. Economic mobility leads to opportunities for children and families of New York City, and we must do what we can to increase it. Thank you all so much and have a great Wednesday afternoon.